we need more nurses. So we're going to be talking about nursing, ways to improve nursing, the profession of nursing, ways to increase the profession of nursing. We're in 2025. Currently, we have a 1 million or more nursing shortage. By 2030, we're going to have a 2 to 3 million nursing shortage. So we need to start being proactive, such as solving problems. Why are we having these low numbers in nursing? Because we need so many nurses. So, and then today I'm also with my wonderful co-host Corey. Hey, Corey, how you doing?
Hello, everyone. Thank you so much for joining Dr. Nicole today as we get into the nursing news and answer some important questions that some young people have written in about nursing. You did mention the nursing shortage being in the millions.
Correct.
Can we talk about some of the major issues people are having on why they're leaving the profession?
Well, I mean, I think that, by me working for 30 years, this will be 31 years next month. I mean, it's hard. It's hard. It seems like no one cares about the nurse. When I was working on the floor, I mean, just to go to the bathroom, you have to get permission, because if you go to the bathroom, people die. Your patient can die while you're in the bathroom. So you have to like announce, can you watch my patient? I need to go to the restroom. We have to be relieved for lunch. And people don't care about your lunch break. Your fellow coworkers are overworked and stressed out. Family members come in very rarely. I mean, every now and then I might have somebody concerned about my lunch break, but most people were not. They were like, I'm like, ma'am, I've been here 12 hours. I have not had anything to eat. And they would look me in my face. I don't care. I want this, and this done, So I think the working conditions were really bad. And in the state that I was at, we tried to talk to them about we need to have a 15-minute break every 4 hours. And they were pulling out the labor laws and said, we don't owe you that. That's if we have time. That's if things are okay. So, I mean, if you're working in an environment where no one cares about you having a break, you have to announce when you go to the bathroom. The patients don't care. The management does not care. I mean, it's hard to keep people in nursing, and we need so many nurses. You have to treat people right and give them some autonomy with basic needs. I mean, I can't care for somebody when I'm sitting here and I got to do a pee dance myself, because I'm sitting here in a code going, oh my gosh, I was trying to go to the bathroom, and out of nowhere we got somebody coming in and being resuscitated. I can't go to the bathroom. I'm trying to go to the bathroom. I remember my last job, I was working in a prison and I needed to go to the restroom. And here we go, overhead, somebody's down and out. And I had to go get a wheelchair, run all the way across to one of the buildings to get a patient, and he's there with some frivolous stuff going. He has blood in his urine. This is not a 911 emergency. But anyway, and this guy is like 400 pounds. So he wants to get in a wheelchair and wants me to push him across the compound, which is the size of a football field. I mean, I'm about ready to die from that. When I got in there, first thing I said was, where's the bathroom? So I went in to use the bathroom first. And then I had him and myself, he was pushing the wheelchair and we were both walking back. I'm like, this is a bit much for me. I'm like 200 pounds and he's like 300, 400 pounds. And this is like, it's a non-emergency situation. So you have those, so different kinds of work environments. It just depends on what's going on, but we need to also be aware that nurses need good work environments so we can keep our nurses. Because I did emergency room for 10 years, the most volatile, dangerous place in the hospital. And then, which did prepare me for the psych hospital I worked at and also prison systems, because it's very dangerous in those settings. So we have to be aware of that.
So with, the nursing shortage, can you explain this? Because some people don't consider CNAs nurses. They don't consider LPNs nurses. where is the line? What does the nursing shortage actually mean, and who's actually included in that?
Well, some of the nursing shortages, the statistics that we're seeing are registered nurses, because we need people who can, call the shots, who can give the medicines, who can do the assessments. Because in certain areas and certain criteria, a LPN, they can't start the assessment. They can maintain the assessment. Like the initial assessment has to be done by a registered nurse in a lot of aspects. Also, like giving blood, you have to have a registered nurse. You have to do a double nurse check, but one has to be a registered nurse. And it depends. Some hospitals it might be two. Depends on if they've had some issues with blood transfusions before and some unpleasant experiences. Then they're gonna crack down and say you have to be registered nurses. Um, and also there is a shortage. I definitely would say there's a shortage of CNAs. There's a shortage of LPNs, RNs, advanced practice nurses. Nurses at a doctoral level is less than 1%. And we need to start educating the public on how to become a nurse and also the benefits of what a nurse can do. You know, I see a lot of people now, when I've had students in nursing school and their family members are like, you got one semester finished, you got this and that. And they're be threatening the students in front of us. Like, you're going to have to do this and that's it. I'm not supporting you anymore. And I've had to explain to parents, I said, ma'am, I don't know how many times this is going to take for this person to finish, but this is an investment in your future. Okay. And when you have a nurse in the family, this person will help you in the future. This person can keep you out of the nursing home. So it may take them a little longer. Be supportive of them. The goal is for them to finish nursing school, and it's very important. So, like I said, I've had to have discussions with family members before, and making sure they understand how important it is to have a nurse in the family and how this will help them in the future and solve some of their problems in the future.
That's totally understood. My cousin is a nurse in our family, and she was very helpful in making sure, as my grandmother was at her end of life, she was able to give instructions on how this is supposed to go, how this is supposed to be, and make everything work. So your idea is correct in what you're saying.
Okay, that's good.
So the next question that we have is, one of the other things people are bringing up as a nursing shortage is bullying and pay. The vet nurses and the nursing shortage. The vet nurses believe that with staffing shortages, you should just deal with what is there. Don't worry about it. Just keep moving. Even if it's 40 patients, you should still take that and move on. New nurses are like, there is no way in the world I am doing that and sacrificing my off days. They're setting boundaries, and the vet nurses don't like the new nurses. Okay. And then the patients, especially through comments on Facebook on every single nursing video I see, they lack a sense of humor for the nurses that are doing things other than nursing, number one. Number two, when the nurses say they deserve more money, they feel like they should just take what they get and not say anything. What does that look like when it comes to bullying, nursing shortage, and getting paid?
Okay, now as a veteran nurse, I call myself an OG. Okay, I've been a nurse a long time, 30 years. I do remember back in the old days where, we took it. We took if there were 24 patients and only two nurses showed up and two CNAs, we worked it. We worked at 8 hours, we worked at 12 hours. We just kept humping. And it's a new generation, and they're like, how many nurses are here? Oh no, I'm leaving. I'm not taking report. I'm gone. Peace out, And then you see them on social media and they're like, I just walked away. I'm not taking report, and someone says they're going to call the board of nursing. So actually, and if they haven't taken report, they are safe, um, because they didn't take the patients, so they're safe. And like I said, this is a new generation. So one of the things we have to start doing is making sure we have adequate staffing and making sure that it's a priority. And if there is not enough staffing, we have to have a plan B. We should be able to call the administrator. We should be able to call the nursing supervisor, the nursing director. It should be like an on call. They have to have an on call list. When I did the emergency room, some of the big ones, they had on call schedule every day. They have maybe one or two nurses who are on call who live within 30 minutes, who knew they had to be at the hospital within 30 minutes, and they were paid like, an extra $2 an hour to be on call. So those were some of the things that some of the hospitals may implement. And also you have your nurse managers and your nursing directors, and we would call them in. And we should be able to have that opportunity to call them in. They're making the big bucks, and they got to make sure that their floor is staffed. But nowadays, we have all these cameras on us. We have, and then when there's a flaw in patient care, people are dying and nurses are getting arrested. I mean, it's very dangerous out here in these nursing streets. So it's hard to say, exactly what's going on. And, you know, I used to love floor nursing. I liked it, just doing it part time, but people didn't want to hire me, especially nurse managers, because when they see your education, they're like, "Oh, I think that you're here to take my job." And I'm like, I don't want to be a nurse manager, ma'am. I just want to come do my job, get a check, get my check, and go home. I'm happy. But a lot of the nurse managers, they won't hire nurses who have higher degrees than they do. So those are some of the things. And then there's a lot of bullying out there in nursing, just like there's bullying in other jobs too. And I guess gate it's a gatekeeping, where they don't give you the information that you need. And sometimes that does happen when you have a preceptor and a preceptee. That means a new grad and a veteran nurse, and they are clashing. So sometimes the manager has to step in, and they have to be honest and say, we cannot work together. This person does not focus on my value system. And, I don't think I want to work with them. And they have to reassign them. I've been on several floors where I've had personality clashes with the person who's trying to precept or mentor me. And, I've had to request, and they've had to request someone else to work with me. Sometimes when young people may have some distorted views, especially if they've not nursed before, been a nurse before. And I've gone places where the LPN has to train me, and I'm a registered nurse. So sometimes that can be a hard situation and scenario if you've not been taught. But at this stage in my life, I realized, we need LPNs, we need CNAs, we need advanced nurse practitioners, we need everyone, and there's a benefit to everyone, especially with CNAs. They can teach you things like how to make sure your patient stays clean and dry. They have little tricks that they've been doing for years. And there are some people who are professional CNAs. They've been a CNA, 10, 20, 30, 40 years. So they have expertise in some things that I might not have coming straight from nursing school. An LPN would have expertise. A lot of places that I've worked, the LPNs are the ones who start the IVs. So they have IV skills. They normally do not start blood, but they manage the blood. So they're more expert on seeing when there's a change in the client in the extremity, and changing their color, their behaviors, because they're receiving blood. So, and they also monitor people with different IV systems going on. They have antibiotics. Some hospitals don't allow them to start the antibiotics. A nurse has to start it, a registered nurse has to start it, but the LPN can manage it. So that's something that is needed also. But in the nursing field of nursing, We need all aspects of nursing. We need all boots on the ground. We need CNAs, LPNs, RNs, advanced practice nurses, and those at a doctoral level, because everybody brings this set of their expertise. Okay. So I think that that's very important.
That's an amazing overall synopsis of nursing. Beauty with the Purpose on TikTok said, first of all, good morning, and
Good morning.
she wants you to explain what an LPN is.
Licensed practical nurse. Well, with nursing, you can come in different aspects. You can start out as a nurse aide. Nurse aide is going to have may have had some training. They're going to do some basic situations like focus on your ADLs, such as making sure this person has food if they can't cook for themselves, prepare the meals, put the meals in front of them, make sure they can go to the bathroom, make sure that they have the proper supplies if they have to go to the bathroom or if they have to have a shower, help them with their laundry, help them remind them of medications and those types of things. So that's where you would have your nurses aid or PCAs. And then you would have your CNAs where they have a class. Normally that's going to be, okay, let me go back to PCA. PCA class is normally going to be 40 hours in my state. Now, then if you want to go up a notch, you want to go to CNA. That's a certified nursing assistant. That's normally 4 to 6 weeks of training. They definitely know what to look for in managing a patient's care. If they're bathing someone, what to look for, how to make sure they stay dry, how to keep the bed dry, how to turn the clients in the bed, how to get them from out of the bed, pivot them to a wheelchair and sit them down, how to use a Hoyer lift when you have a person who's bedbound and they have to roll and you put the Hoyer padding underneath, connected, and then it lifts them up and they can move from the bed to a chair safely and you don't have to lift them and use your back. So they have a lot of different training, and they also have to take a state test that is proctored, and you have to go in and it's under cameras and all that kind of stuff, and you have to pass that test for the state to be a CNA, that's certified nursing assistant. Then you have your LPN. Your LPN, that's licensed practical nurse. That is going to be your technical nursing. That's what that is called. You get that at a technical school, such as some high school programs, or even those the technical schools where they have other trades, because LPN is considered a trade school training, where they do are taught to start IVs, manage IVs, also do patient care, signs and symptoms. They are taught anatomy, physiology. They're taught, math, science, some English. It depends on what's going on. But they have a curriculum. And normally the LPN school is for 1 year to 18 months. So it is a certificate. Sometimes they may call it a diploma. Okay. But it is not a degree. You do not get a degree as an LPN. That is not so. You get a certificate or a diploma as an LPN is at a technical level. Now, here in the state of Virginia, we have some good news. Finally, to be an LPN, they're looking at merging programs where, because LPNs still have to take the English, the math, the psychology, the sociology, anatomy, physiology. Some may have to take chemistry. So they have programs where that's at a technical school. So even if you want to go to registered nursing, you have to take all of that over again at a university or at a college level, because at LPNs are done at a technical school, not at a college or a university. So normally they would have to repeat all of those. So our governor is signing documents that saying that when you transition from LPN and you want to go to registered nursing, that we're able to take those credits from them, and they don't have to repeat the Englishes, the maths, the sciences, and all that. They can go into the RN program and take the entrance test, which is actually going to be helping us here in the state of Virginia. So we'll have more LPNs who want to go to RN school because they don't have to start at the bottom again and repeat English, math, and psychology and all that. We'll take those credits. So I know at the community college that is down the street from me at Bright Point, they have an LPN program, but that's at the community college. So that means those are your Englishes, your math, your science, and all that is done at the community college. So, and that's at the college level. So those transfer directly over, and their LPNs are able to go straight into the RN program. So it's no wait time, it's no downtime. You don't have to repeat all of these classes that you've already mastered. Okay. So that's pretty good. So I like that concept. I was really impressed with our new governor who has that on his docket. And he sees the value in that. That's really good. Now we have our registered nurse. Our registered nurse is going to be our licensed registered nurse. You have to take NCLEX, and also the LPN has to take a. It's not called the NCLEX. It's a form of the NCLEX, but they have to take a state test also to be licensed as a licensed practical nurse. So then you have your registered nurse, which is going to be with the increased critical thinking skills. When you're a registered nurse, you have to uh, look at different aspects of what's going on. You take different bits of a client and you put it together more of a puzzle, and it's more of a critical thinking aspect. We start our basics with research, where we're collecting data to see if what we're doing is making improvements in the care of the patient, such as how about preventing falls? Are we preventing falls? Why is this client falling? What is causing them? What are some things we can do to decrease their ability to fall? Also, wounds. We're looking at wound issues. Why is this patient having a wound? Is the wound getting better? What are we doing to improve? Is what we're doing improving this wound? When should we call in a doctor to review this? And which doctor should we call? We call in the wound specialist. Are we going to call the endocrinologist to manage their diabetes, which is causing an increase in their wound? It's so many things. Also, if we have somebody with a heart issue, congestive heart failure, and they have a wound on their leg or their heel, so now we have congestive heart failure. Now we have an issue with the blood, the good blood being pumped down to the foot and coming back up. And the problem is it's pooling because we have congestive heart failure, but we also have diabetes. Now we have a person who has a wound on their foot, lower leg. We have to assess, do their A1C. We have to do the after checks daily. We have to do their A1C, which shows their blood glucose levels for over the last 3 to 6 months. So we need to take that information. And then we also need to connect with our internalists to see, can we bring all of these people together? And also we need to talk to our nursing and our CNAs to see how often this person is being changed. Are they wet? Are they dry? How long are they staying in their urine? Are they cooperative? I have clients now who are incontinent. We're having an issue with them, and a little itty bitty wound the size of a dime, and she's not cooperative with bathing. She's not cooperative with repositioning. She's not notifying anyone that she is wet. And when I met this client, she was living by herself. She's able to get up, pivot, and go to the bedside commode on her own. And over time, she has declined. And now she's incontinent. And I don't know if she's just giving up hope. I'm getting ready to give her some mental health services because we're wondering where is this coming from. She's in her 40s, so we're having someone who's in their 40s who has been able to get up, pivot, and go to the bedside on their own, even though that they're not able to walk. But now she's in a decline, and we're noticing that, she's, not cooperative. She's like, I don't even want to bathe once a week. Well, I think that we're going to have to put our foot down with you and make sure you're bathing more, make sure we're repositioning. We wanted to get a donut. That's something you sit on to get the pressure off of your bottom. So you use your donut, you change positions every 2 to 4 hours and use that donut on different places, on the left, right, maybe in the middle. So those are some different things when you have somebody who is a wound that you're going to be looking at, and then we're going to look at some of our statistical data. What's causing it? Have we had other clients with this problem? How did we resolve it before? Did she come in with the problem? Did she leave with the problem? Is she responsible? Who's helping her? So when you have a registered nurse, they're looking at all aspects of it, and it depends if we have a technical registered nurse. That's when you have an associate's degree, and it's a 2-year program, and you're going to get the bare basics about what's going on, and it's going to give you an introduction into statistics and research. Then you're going to have your baccalaureate program, which you're going to have more foundation in nursing. And then there are nurse theorists. All the foundations of nursing fall under our first nursing researcher, which we will be celebrating in a couple of weeks during Nurses Week, and that is Florence Nightingale. She was the initial first nurse researcher, and she started collecting statistical data on her patients that she took care of in the Crimean War in England back in the olden days, in the 1800s, 1900s. So we have that information that she was out there walking around. She was known as the lady with the lamp, and she would walk around and she would say what was the problem? Why were our soldiers dying? She was assessing, were they having access to clean water? She was having, do they have access to clean and dry clothes? Are they having food, good food, clean food, food that can help them? Also, are they getting being able to get up? Are they having wound care? Are we cleaning their wounds? Are we using appropriate supplies to clean the wounds? How often are we cleaning the wounds? When do we need to seek other guidance with wound care and all of those things? Are they able to go to the bathroom on their own? How often are they having a bowel movement? Are they being cleaned properly before and after? Are they able to urinate? Is that in a clean environment? Are we able to make sure their skin is dry afterwards? So those are some of the things at a baccalaureate level we get into more in detail with the research. That's where we start in detail with the research. So again, our technical registered nurse is going to be at the ADN level, associate's degree level. I have an associate's degree. There is a difference with an associate's degree. And then I went to an RN to BSN program, and that was all writing papers and with more of, like I said, the research and looking at our nurse theorists. 14 characters of care, which are different aspects of care that a nurse should be focused on to make improvements in the client's health. And then after that, you have your master's level. I have a master's in administration. You can get a master's as a nurse practitioner, if that's what you want. We also have gerontology, pediatrics, psychology. There are different specialties in at a master's level. Also, I have a college that I just love. I can't think of the name, but it's a nurse entrepreneurship school, and that's at a master's level. So if you are a nurse and you're interested in being an entrepreneur, there is a college out there that at a master's level, they teach you about being a nurse entrepreneur, so you can start your own nursing business. Then you can become a doctor of nursing. You can have a PhD in nursing, which is a philosophy of nursing, or you can have your DNP, that's a doctor of nursing practice. So there are many aspects of nursing. Nursing, you can start your career in nursing, like I said, as a PCA, as a nurse aide, personal care aide, CNA. You can also, after your CNA, you can get your med tech. Med tech is going to be, golly, I think that's like a couple, it's 6 weeks, 6 weeks, and you learn about, it's focused on medications. Med tech is, that's going to be a higher rate of pay than a CNA because you're able to give medications under the guidance of a nurse, registered nurse. And you're also able to do medications at an assisted living facility, not a nursing home, at assisted living facilities where you have private pay clients, and you may have a few, they normally have a couple of beds for a Medicaid patient under the auxiliary grants. But most people on the assisted living are under a private pay. So in a private pay facility, they would hire a med tech, a CNA that has her med tech, and they can give medications. And then you can have your licensed practical nurse. That's going to be your 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 nurse, your technical nurse. And then you can have your associate's registered nurse, and that's also at the technical nursing level, but a step up in as a registered nurse. And then you have your baccalaureate program. Now you can have some clients go straight to a bachelor's degree in nursing. That takes 4 years or five. It depends. It's kind of hard. It's a hard program. And now at some schools, they do, I don't agree with it, they have a entry level to nursing at a master's degree. And you know, that is an option for those people who already have a degree, a healthcare degree in something else. And they want to go straight into nursing, and they can go into a master's program. I would like most people to at least do an associate's or bachelor's degree where they can get a foundation in nursing before they go to the next level. Um, but those are some of the options that are out there. I have a son now. Both of my boys are graduating next month in pre-med from Virginia State University. I have one that's getting ready to take his MCAT. So he hopefully in the spring, he will be in some medical school somewhere. And then I have my other son, my oldest boy, who is also a medic in the National Guard. He decided he wants to go to nursing school. I said, really? After all of this time? So I'm trying to get him into a baccalaureate, accelerated baccalaureate RN program. He is not buying that because he does not want to spend the money. He wants to go to associate program at a community college because it costs less. I was like, okay. So one way or another, he's going to go to RN school. So we'll see. And then he's like, I think after that, and I'm able to be on my own, I'll go back. I want to go to medicine. I said, okay, we'll see how this goes. So, those are some ways that you can get into. My second son, he's anesthesiology all the way. I try to show him about being a nurse anesthetist, but that's less money when he learned in ninth grade when he started taking his health education classes. He was like, Mom, I'm going to go to medical school. I'm going to be an anesthesiologist because they make more money than nurse anesthetists. I'm like, okay, fine. And then, of course, I have my future nurse, Nicola, and she's finished her CNA, her med tech, and now she's ready to start pursuing either her LPN or RN. So I'll keep y'all posted on that. Okay, so we have some people going in. Well, in my household, still focus on health careers. Now, normally they say nursing and medicine runs in the family, so I wanted to go over that aspect. I have my father's baby brother is an emergency room doctor, and he also owns his own methadone clinic. My cousin, she went to medical school, decided to drop out at the last year, and she went to law school. Like, you can still do both if that's what you want. Also, I have a cousin who is a doctor. He just retired from the VA hospital. He worked at the VA as a VA hospital doctor all his career, and he just retired. Also, my children's father, my ex-husband, his sister, it was a registered nurse, and that's how we met through her. Her husband was a physician in Nigeria, and her oldest son is also a doctor. And then one of her other sons are interested in nursing, and her granddaughter is interested in becoming a doctor. So, and then their uncle also in Nigeria was also a doctor. So, and then also on my mother's side, I have my cousins, our nurse. I have several cousins who are nurses. I would say about five or six, and then one PA. So, health careers can run in a family. because you're going to need someone to be on top of your situation. I know I've had to call my uncle to go, my son, my kids, all of my kids were on breathing treatments, had a touch of asthma or what have you. So I always had to call him to get a prescription for something with those kids. So it's always good to have someone with a medical background in the family to at least bounce some ideas about or to see what's going on. So just some of my, my history about the family members who are in healthcare careers.
All right, Doc.
Okay.
So as we are talking about nursing careers that are coming up, um, there are articles that have been written for this year that the most difficult parts in the hospital that cause the most burnout are emergency rooms and intensive care units. Um, why do you believe that is, and what does that look like for incoming nurses that may enjoy the excitement of being in the emergency room with something new every day? How do they determine which area they need to work in the hospital, or which facility they should work in as a nurse?
Well, I would definitely say emergency room nursing burnout is very high in ICU. ICU is going to be one nurse to 1 to 2 clients, but that is high stress because you have a client who they have to do hourly input and output. That's in I's and O's. That means they have a Foley. They have to assess what's going in every hour, what's coming out. They may have a G tube. They may have a PEG tube. That's the way that we're feeding them or giving them fluids. And we have to calculate how much goes in, how much is coming out, how much can you aspirate. Also, they're on heart monitors. They may have 2 or 3 IV lines and they have drips that are going in. So those drips have to be calculated every hour. They are on machines. That's where you have all the beeping sounds. This person normally, because they're also intubated. If they're intubated, they have to also put them to sleep. So they will be able to breathe. They won't be fighting the machine. So they're going to give them some medicine to relax them so the machine can breathe for them. Because sometimes when you're waking up, first thing you're like, take it out. They're doing this because they want that tube out of their mouth. It's very uncomfortable. And you have to give them medicines to mellow them out so they can rest their body so the machine can do the breathing in, breathing out. So, and that's a lot, even though you might think they only have one patient, but that one patient needs so many things. They need a lot. So it's very stressful. And like I said, a lot of nurses, you don't know. If you're not a nurse, you don't know. You can't go to the bathroom. You have to announce, I need to go to the restroom. Can you watch my patient? Because when you come back, your patient can be unalive. That's the new term they have out. So those are some of the things. And then emergency room, oh my gosh, I did that for 10 years. Very stressful. Sometimes we were on the dock and you'll see birds flying. And that's a sign that people are coming in to die. Never fails. You see birds flying in on the dock. There, we're having a rough night. We're gonna have a rough night. And then it's just very dangerous. EMS pull up. Sometimes they call, sometimes they don't. Family members pull up in the car and they'll drop off a patient. They might not be breathing, especially these young people. They'll come up to the hospital, pull up, push somebody out the door and drive off. And I'm like, what happened here? On emergency, I'll be on the dock and somebody pulls up. I'm having a baby. What? We've gotten out. Somebody pulled up and parked. We had to go out. She's having a baby in the parking lot. Oh my gosh. I've had patients come in. This man had his hand caught in a combiner. Blood is spewing. We have to put a towel on the nub that is left. Get a pillow to carry the arm and walk him into to his hospital bed, to the emergency room hospital bed. and start, services on him. How in the ER, oof, I mean, I can tell you some stories. I mean, I've never seen anyone with every bone in their body broken. This little girl, the director, her son's girlfriend was hit by a transfer truck in a little itty bitty car. And I had to prepare her body for her mother and family to come in to view her. And I had never seen anyone, every bone in her body was broken. I mean, I'm trying to lift her arm and her arm is going all, I mean, it's just moving. And I mean, I'm having to brace it so I can put her arm in a position that is appropriate. And I mean, it was just, I mean, her legs, everything was moving. I mean, this going in positions that didn't even make sense. So, and then I had one of the reasons I had to leave, it was 10 years. And it was before I had my children. This little boy died on Christmas Eve, had a seizure. I'm like, it's just like, how, why would this child have to die on Christmas Eve? Um, so that's really a bad, some of the bad horror stories. That's not including the gang violence. Oh my gosh, gang violence is crazy. On a Saturday night, and they're shooting up, and that person comes into the hospital and does not make it. We have the neighborhood shows up. We're talking about 50, 100 people in the middle of the night, who come in, and they're not happy when we have to announce that this person has died. And, a lot of times you don't realize that drug dealers may be the hero in the community, because when they're making money, they give out money to other people, so it's a system. And when something happens, they're having their drug wars, it ends up at the hospital because we have, they stop breathing, they're shot. And it causes a big problem when they don't make it. And a lot of people are mad with the hospital and the hospital staff. And it's been many days where we have to call the police just to be able to walk out to tell the family that they did not make it. And it gets ugly. I've had people, knock a doctor down, punch a doctor, knock us down, nurses. Sometimes we have to be in the middle of the doctor and have the police beside us, and the doctor is behind us, and he has to announce to the crowd. Now, sometimes it's gotten to be 200 people outside. They didn't make it, and we can't, and it's a big mess. So it can be very dangerous. Like I said, I have been slapped. I have been punched. I have been pushed. I have been knocked down under the stretcher. I've had to stay under the stretcher because family members got to fighting over their father had died. And the family members, the sons, they want this watch that's on daddy that is turning his skin green. He was green before he got in. The arm is green. And the sons, who are 6 foot plus, got to fighting, and and I had to stay under the stretcher so I did not get hurt. And their mother came in, and she had to slap both of her sons to calm the situation down. I've also I used to have those little reels. It only took 2 times for someone to say, "Oh, you the nurse?" And look at my badge and go and wrap it around me. The second time I realized I don't need a reel anymore. I only wear clip-on badges is for safety purposes. So yes, it's very dangerous, volatile. Like I said, I have been, and I have 3 children. I've been kicked in the stomach with both of my sons, um, at different times. Yep, by patients. And I know I was at least 6 months with both of them. So, yep, kicked in the stomach both times. And of course, let me tell you something. My coworkers are not empathetic or sympathetic. They were like, are you bleeding? I was like, no, get back to work. Now, how many of y'all would stay at work after you've been kicked in the stomach and you are 6 months pregnant? Yeah, yeah. So, yeah, I didn't have any support system. Coworkers were not supportive. Nurse manager was not supportive. We don't have anybody else. Unless you start bleeding, then you'll have to go upstairs to L&D. If not, get back to work. And of course, they'll go, if you leave, we're going to call the Board of Nursing and take your license. So you need to decide, are you going to stay at work, or are you going to leave now without our permission, and we're going to have to report you to the Board of Nursing? So, yeah, high turnover rate, I understand, and high burnout, because it's vicious out in those nursing streets. Okay, I know. That's why some nurses are wising up and wanting to be nurse entrepreneurs, just like I am, So, those are some of the reasons why I stay as a nurse entrepreneur. Because I remember how it was at the hospital, and it was hard in those nursing streets. And I'm so used to now being off on holidays, because when I was a new grad, for the first 10, 12 years, I spent all of my holidays, either Christmas Eve, Christmas Day, I had to work at the hospital, either day shift or night shift. New Year's Eve, New Year's Day, had to work at the hospital, either day shift or night shift. Thanksgiving Day and Black Friday, that's a rough day that you do not want to be working Black Friday. Everybody shopping, seeing it on the news, can't see the parades. You have to work. So no one's thinking about that, nurses give up their holidays. 4th of July, you can't go anywhere. You got to either work the 4th, the day before the holiday, or the day after. So if you go somewhere, you got to cut it short. Labor Day weekend, that's my birthday. I mean, I'm just now enjoying having birthdays off. I've never had that before. Um, and then I was working for Medicaid. First time I had Martin Luther King birthday off. Oh my gosh, I got a holiday. President's Day is a holiday. I never knew those were holidays. Easter, you have to work. You got to work the day before, the day after, day shift or night shift, because you have to cover the shifts. And you normally have to work 2 holidays in the winter and 2 holidays in the summer. So they split them up. So, your winter holidays are going to be Thanksgiving, Christmas, and New Year's. Your summer holidays are going to start with Easter, Memorial Weekend, 4th of July, and Labor Day. So you got to pick which 2 holidays you want to work for the winter and for the spring and summer. I do not miss that. Love having autonomy. Start your own nursing business. So many opportunities out there. All righty. Well, let's wrap it up. It's been a little bit while longer. One last question. Are you ready to wrap it up, Corey?
I want to ask one last question, and then we'll be done. So, we're going to end it with this. The aging community, 70% of men and elderly people are not prepared for long-term care.
Correct.
How does this affect the cause that the nurse dolls exist, and what's the importance?
The importance is that we need more nurses, and we need nurses in the family. I think that will solve some of our problems when you have someone who's on the first line of healthcare right in your midst. We need more nurses, and we start them out when they're small, exposing them to the career of nursing. And nursing is STEM. You're going to use your maths, your science, your technology, and you're going to engineering is in nursing. I remember back in the day, we had to build our own Bucks traction. That means we had to use tools, hammers, screwdrivers to build a Bucks traction. That's Bucks traction was used back in the old days when people had broken their legs, and we tried to straighten their legs, their broken legs back together. So we had to use Bucks traction by applying some weights. So we used to have to build those contraptions. So yes, we have some engineering skills. Also, wound care. We had to it's engineering. It's putting stuff together so you can apply suction to a wound womb vacs and those have you. What those, those are equipment that you have to put together, learn how to put all those things. So that's a form of engineering that nurses do. In technology, we use that all the time. So we're trying to educate people about what nurses do. And we want to start them young as to exposing them to a career in nursing and how you can be an asset to your family and also the community and the world. And a lot of people are not prepared for their long-term care. A lot of people, if you go to a nursing home, you can ask them, how did you end up in a nursing home? What happened? What led you to be there? And I wish we would have people, especially talk to our men who are leaving their families, who are out here in these streets. It's so many times I've had to had discussions with family members. You have this gentleman and I have some of my clients, 60, 70 years old, and they have children. I have a gentleman now that has 7 children. They have nothing to do with him. You know why? He left their mother for another woman, and they cannot stand him. And I wish we could start talking to our men and letting them know the importance of keeping your family together. Yes, we know marriage is not perfect, but you have to be available for your family. And sometimes you have to sacrifice and say, I need to stay with my family because I am investing in my future. Because these children that you are walking out on, you're leaving for other women and taking care of the other woman's family, these are the people who you're going to need in the future when your health fails you. I have gentlemen now who on dialysis, high blood pressure, kidney failure, and they have 5, 6, 7, 8, 10 kids, and their children have nothing to do with them because they walked out on the family. Please think about some of the things that you're doing. And like I said, marriage is not perfect, but you've got to have a relationship with your children. Remember, when you leave your children, these are the people who are going to have to make the decision as to whether or not to pull the plug on you. Okay. They might not talk to you, have nothing to do with you. But when it's time to make the decision, if you're unmarried or you are, a lot of people are separated and they never marry. That woman who you are legally married to, she will make the determination of what's going to happen to you. Those adult children that you never had anything to do with, they're going to be the ones to make your final decisions as to if you are going to be on life support, if they pull the plug on you, whether or not you're going to have a nice funeral or if you're going to be a ward of the state. People don't understand these things. So when you're out here and you're young and you have a family, please take time and think. You have to invest in your future because these decisions that you're making will have a lasting impact on you. Okay? So that's my final words for today. Next weekend, we're going to start getting ready for our nurse graduation. We're going to start talking about nursing and graduations, getting ready, all this cute stuff. I got my 2 boys are graduating next month. So we are in graduation mode, health, career, and nursing graduation mode. And we are so excited. And congratulate the people who in your family, especially if they are CNA, LPN, RN, advanced nurse practitioners, doctoral nursing, and also those who are in any kind of health career. It is graduation season. Let's get ready. And, check us out at thenursedolls.com. Any final words, Corey?
I just want to thank you so much, Dr. Nicole, for joining us today and giving us all this valuable information. I know that a lot of men are going to hate what you said at the end, but maybe something has to be said.
Yes, and I wish more men knew that when you walk away from your family, you are walking away from your future. Okay.
It's one of those find out situations.
Yeah.
Well, we are going to go live again. If y'all have any questions, please email at info@thenursedolls.com. Send a DM or comment below any of these videos. We'll get back with you as soon as possible. If you are a nurse and would like to be featured on our lives and answer some questions, please send us an email or a DM as well. We want to thank you so much for joining in today. And thank you for the comments that have been given. Shop online at thenursedolls.com for our worksheets, our books, as well as your own commemorative nurse doll, Nurse Linda or Nurse Nicole, so that you can have that as we build up our nurse brands. If you look behind Dr. Nicole, these dolls are selling fast. So we hope that we are able to see y'all soon. Thank you so much, and y'all have a great weekend.
All right. Thank you so much. Have a great day.